This was an analysis of the COMMANDER-HF study, which had been published just a few months ago. And what we did in this analysis was, based on the results in COMMANDER, we recognized that mortality was the main driver of the primary outcome of that study, and that many of the deaths were due to heart failure. However, thromboembolic events still continued in the COMMANDER study, and we felt that there might be a signal for Rivaroxaban favorably affecting those thromboembolic events. So we decided to do a sub-analysis and look at that a little more closely, and that's the basis of what we did. So in the study, we used the COMMANDER population, and just as a reminder, these were all patients that had heart failure with reduced ejection fraction. They had chronic heart failure, but had experienced an episode of worsening and predominantly a heart failure hospitalization. And these were also patients that had evidence of coronary artery disease. They were in normal sinus rhythm, and they were then discharged from the hospital, and within 21 days of discharge, they were enrolled in the study and randomized to receive either Rivaroxaban at a dose of 2.5 milligrams twice daily, or placebo on top of standard care therapy, and then they were followed at regular intervals through the duration of the study. So this is a post hoc analysis, and we used a composite of events that we felt would represent the thromboembolic risk that this population would be exposed to. So we incorporated myocardial infarction, ischemic stroke, sudden or unwitnessed death, pulmonary embolus, and symptomatic deep venous thrombosis. So this was a composite of those 5 components. The results were a 17% risk reduction, which was significant in favor of Rivaroxaban compared to placebo. During the course of the trial, nearly 15% of patients had experienced one of these events, and Rivaroxaban reduced the risk by 17%. So I think there's some important practical implications. Number one, for many years we had been looking at a possibility that thrombosis was a driver of the poor outcomes in patients who were hospitalized for worsening heart failure. And this clinical trial, COMMANDER, showed that that's not the case. However, patients with atherosclerotic disease continue to have thromboembolic events. And the analysis that was done in this case shows that low-dose Rivaroxaban has a potentially favorable effect in reducing them. That's very similar to what was shown in both the COMPASS study and in the TIMI 51 Atlas ACS2 study, which looked at patients that also had coronary disease. So many of the patients, because there's now an indication for using low-dose Rivaroxaban along with aspirin therapy in patients post-ACS based on the results of the Atlas study, if they were hospitalized for worsening heart failure, one would keep them on this therapy